It's time now for Medical Moments with Covenant Healthcare. Today we are talking about structural heart disease and what procedures Covenant offers to help. Joining us this morning is Debbie Best. Thank you so much for being here with us.
You're very welcome. It's my pleasure.
Yes, we're happy to have you. So tell us, what is structural heart disease?
Well, structural heart, you have to think about your heart. There's something that's abnormal with it. The valves aren't working the way that they should. There's maybe some tear, or there's maybe a hole that's not big, where it should be opening up fully. It's not. So something has happened where it's abnormal now, and it causes you to have symptoms or causes you to have something different than what you're used to. An example would be our TAVR, our transcatheter aortic valve replacement.
Yes.
It used to be that patients had to have their chest cut open in order to have the valve replaced. Well, we've been doing this procedure since 2014, and patients that are inoperable, high risk, moderate risk, and low risk as of last year can have this procedure done where it's actually done in through the groin. So you don't have to have your chest cut open. You can actually go in. Many of our patients go home the next day. So it is phenomenal for patients for recovery phase. Our average age of our patients in the mid-80s. So you think of a patient in their 80s having to have their chest cut open. They don't do well many times with it, depending on how debilitated. These patients can be pretty sick. You have some who can't get around and do anything. With this procedure, it makes it so they can now function. They can go walk to the mailbox, walk their dog, go cut wood, go enjoy life that they should.
That is very interesting and also very helpful for those maybe who are elderly and don't want to go through that process. But I want to ask you, there's another procedure being performed at Covenant to help reduce the risk of stroke. Do you want to tell us about that?
That one is called a Watchman procedure, and that is for patients that have atrial fib and have problems taking medication, such as your Coumadin or anything like that. Maybe you have a lot of bleeding events from a GI bleed or a stroke. If you have a history of a stroke, if you have history of falls, if you have a job where maybe like a policeman and taking Coumadin's not a really good thing for you because of all the side effects and everything that can happen. This procedure, actually, you have your left atrial appendage, so it's off your left atrium. That's the top part of your heart. And when you're in atrial fib, your heart just quivers. So what happens is this little outpouch blood accumulates there and forms a clot, and then it can go out and cause a stroke. So 90% of your strokes are caused because of that. So your Watchman device is actually this little thing here. It looks like a jellyfish or a parachute to me. But this is placed in that area, and it seals off within about 45 to 60 days, and then you don't have to worry about that.
Wow.
So that makes it kind of nice.
It is so small, too.
It's very small. It's very small. The areas, the appendage, they call them chicken wings or broccoli. We've even seen one that looked like a shrimp.
Oh, my goodness.
So they're all different sizes and shapes, and we have to make sure that they're deep enough and wide enough for us to be able to put the device in and for it to sit there, because you don't want that popping out.
Yeah. Well, what makes the Structural Heart Program such an asset to the community?
Well, number one, I think because of your patients, the healing process. When you don't have to stay in the hospital for a week, when you don't have to have your chest cut open and then try to recuperate from that, it's wonderful for patients of any age. You have to think about the cost. I mean, number one, you're in the hospital for 1 to 2 days on average. You think about families having patients in the hospital, having to go see them. Who's going to take care of them afterwards because they can't do the things they want to do?
Money can add up.
So really, all of that can benefit from having this procedure done versus having your chest. Now, if you're a younger person, if you're in your 50s and you have a valve issue, maybe having surgery might be better, because this valve, we're not really sure how long it's going to last you. So in your lifetime you're probably going to have another one, where a surgical valve will last longer. The testing we do is phenomenal, because you have to make sure this is the best thing for the patient, so they have to have a cath. We want to make sure your arteries aren't blocked, because if you need open heart, then you really should go for open heart and have both procedures. We have to make sure the vessels are big enough and clean enough, because if we can't get them up the groin area to the heart, that's not going to be beneficial to you either.
So there are a lot of things to look at.
There are a lot of things to look at, and patients always like, why do I have to see a surgeon and a cardiologist? Everything is to make sure that this is the right procedure for you, and it's in collaboration of the surgeon and the cardiologist working together.
And I'm sure that every patient is different, but I want to ask you, why do you love to work with your patients?
I love to work with my patients, number one, because I like to see them get better. I like to see a patient that comes in and is depressed and can't do things, and then the next time I talk to them, they're like, oh, well, Jack's out cutting wood and he hasn't done that in years. We actually, our first 4 patients, one of them, he was an older man, had oxygen at home, and when I went to see him the next morning, he was sitting up, already had his breakfast, and
wow.
I said, you look really good.
Yeah.
He goes, I feel good. He goes, you want to go dancing?
Oh my goodness.
So, you know, just having somebody all of a sudden have that vibrance and being able to do the things that they want to do. Because sitting on a couch doing nothing and feeling like you can't contribute, it's not satisfying. It's not the quality and the kind of life you really want to live.
That is amazing. Well, thank you so much for being here with us today.
You're so welcome.
If you would like any additional information on today's topic, just head over to the Hot Links page on WNEM.com.